In this video, I'm going to show you how to set up and use an automated external defibrillator, or AED. If a person isn't breathing, the odds of them resuscitating from CPR alone is less than 5%. If an AED shock is applied within 2 minutes of their cardiac arrest and they're receiving good quality CPR, those odds of resuscitation go up to 80%. For every minute that passes, the odds of resuscitation go down by another 7 to 10%. The combination of good CPR and applying an AED quickly is the key to resuscitating any person who's suffered a cardiac arrest outside a hospital. When a person goes into cardiac arrest, it's rare that their heart will just stop altogether. A beating heart does its job well because it's regulated by a fairly complex electrical system. When a complex electrical system fails, it's often a matter of being stuck in a bad pattern. Think of a computer that has a frozen screen. The computer isn't necessarily broken, it's just caught in a loop and can't perform its normal functions. Something similar can happen to someone's heart. The most common pattern, by far, that causes a heart to stop beating is called ventricular fibrillation. When a heart is in ventricular fibrillation, its movements are erratic and can't move blood through the body. This must be corrected very quickly for the person to have a chance to survive. That's where the AED comes in. An AED with pads attached to a person in the correct position can detect whether a person's heart is in ventricular fibrillation. More importantly, if it does detect this pattern, it can shock the heart with electrical energy, essentially interrupting all activity in the heart or turning it off. Just like if your computer crashed, you would probably try and fix the problem yourself by turning your computer off and on again. The AED effectively does the same thing to your heart. Once electrical activity is stopped, a heart that has lost its rhythm will often regain its original normal sinus rhythm if it's in good enough condition and will start beating again. The good news is that AEDs are very easy to use and they're very safe. They talk to you and they tell you what to do every step of the way. Most have simple interfaces with 2 buttons, one to turn the unit on and off, and one to deliver a shock. Many AEDs will also guide you through doing CPR, and some even have feedback mechanisms to coach you through CPR, telling you to push harder if necessary, and telling you when you're doing a good job. An AED typically comes with a fast response kit. This kit includes a CPR pocket mask and gloves, scissors to cut clothes, a razor to shave a particularly hairy chest, a cloth to dry sweaty skin, alcohol wipes, and sometimes extra AED pads or pediatric pads. First thing we want to do is to turn on the AED and listen to the instructions. You will need to bare their chest. Scissors will be packaged with the AED in order to make this easier. Cut clothing if that'll save time. Try your best to work around the person who's doing CPR while you set up the AED. Their chest should be completely bare, including bras and medical patches. Next, prepare the chest. Pads stick best to clean, dry skin. If the person has a very hairy chest, this could interfere, so there's a prep razor included in the AED packages so you can shave them quickly. Remember, time is key and it doesn't have to be perfectly shaven. Most people in cardiac arrest will be sweaty. There should also be an absorbent cloth in the package to wipe them dry. Now we can apply the pads. There are pictures on the pads that show you where to place them. The placement doesn't have to be perfect, but get it as close as you can to the picture. Avoid things like pacemaker scars, piercings, and jewelry by at least an inch. Once both pads make good contact with a person, the AED will know. It'll tell you that it's analyzing and to not touch the patient. Make sure everyone is standing clear when it asks. If it determines a shockable rhythm, it'll tell you to push the shock button. Make sure no one is touching the patient. Once the shock button has been pushed, the AED will tell you to resume CPR. Start right away. If no shockable rhythm was found, it will tell you to resume CPR right away without shocking. Leave the unit on and continue to follow the prompts. The AED will now guide you through 2 minutes of CPR, and at the end of 2 minutes, it will analyze the person's heart again and continue to do so until it's turned off. If there are clear signs of resuscitation, then you may prefer to turn the unit off, but leave the pads attached until responders arrive and give you directions. Many AEDs record information during the rescue that might be useful for their doctor. Some AEDs might come equipped with special pediatric pads or have a pediatric switch to tell the unit that it's attached to a child. If the unit is not equipped with these, don't worry, it's generally safe to place adult AED pads on a child.